the flu shot is more important this year than ever. And I actually had a really good conversation with a colleague of mine, infectious disease doctor, and we talked about the fact that if someone were to contract the flu and COVID-19, and remember, we're right in the middle of the pandemic, a lot of people are getting COVID-19. If you get the flu and COVID-19, that means your immune system has to work extra hard. And if you are someone who has a likelihood of getting pneumonia, which is a severe complication that could take your life, now your chances are much more likely. So it's so important we get that flu shot.
Wow. Are you seeing flu at your practice already, Dr. Quinn?
Yes, I have. I mean, this looks like it's going to be a pretty significant year. We've had patients with the flu, not as much yet. The flu activity usually picks up around October, November, and then it's worse in December and January. But we are seeing some people to come in with symptoms of the symptoms of the flu to include fever, body aches, chills, cough, runny nose. We'll do a flu test, and in some cases, we have had patients that come back with positive flu tests. Now, the good news about the flu is you can treat it, but you want to try to avoid it because with COVID-19, the hospitals, the emergency rooms, the clinics, they're already almost at full capacity. So if you can get a flu shot, that can help you so you have much less of a chance of getting the flu and you can avoid it. And with COVID-19, even more so this year, it could save your life.
Yeah, it sounds like it's going to be a difficult time because we're not going to know if we have COVID or the flu.
That is correct, because the symptoms in most cases overlap. I mean, we talked about fever, chills, congestion, runny nose, body aches, cough, shortness of breath. You can see these in the flu and COVID. Now, one thing that's being distinguished right now, though, is COVID distinctively will give you symptoms of loss of taste and smell, but you don't want to rely on that because everybody that gets COVID does not get those specific symptoms, but that is one thing that we're using to differentiate. But as time goes on, we are getting more tests, so we're able to test more people for COVID and the flu. But the take home is if you get that flu shot, then you're giving yourself an extra layer of protection, and there's a much less chance that you'll get the flu if you get that shot. And lastly, I just want to add that with all the COVID-19 precautions, such as social distancing we're doing, wearing our mask, not going into large crowds, and hand hygiene, it's going to help with flu season. But still, if you can get that shot, that's an extra layer of protection. And as I said earlier, for a lot, it could be the difference between life and death.
Yeah, thank you, Dr. Quinn. Appreciate that. Good advice.
Yeah, it is. And now that we got this little cool weather coming in, it feels like, well, it's cool to me. I mean, 70 degrees, that's cool for a Southern girl.